Regenerative medicine, built on the twin pillars of stem cell science and bioengineered tissues, stands on the cusp of revolutionizing how we treat age-related organ failure and perhaps aging itself. Unlike traditional therapies that merely slow degeneration or treat symptoms, regenerative approaches aim to actively rebuild and rejuvenate damaged tissues, offering a fundamentally restorative strategy that could profoundly extend healthy lifespan. Recent breakthroughs highlight just how close this vision is to reality. Scientists have already succeeded in growing patches of functional human heart muscle from pluripotent stem cells, and in primate studies, these grafts have restored significant cardiac function after heart attacks. Such advances have moved rapidly from bench to bedside. Human clinical trials of these stem cell-derived cardiac patches are already underway, marking a major milestone for regenerative cardiology. The possibility of repairing a failing heart with new, patient-specific tissue, rather than relying on a donor organ, would transform the prognosis for millions suffering from cardiovascular disease, the world's leading cause of death. Similar progress is unfolding in other organs. Kidney organoids grown from stem cells now demonstrate rudimentary filtration capacity, offering hope for future treatments for chronic kidney disease without the need for dialysis or full transplantation. In the liver, researchers are generating bioengineered tissue patches capable of metabolizing toxins and producing essential proteins, a potential lifeline for patients with cirrhosis or acute liver failure. Meanwhile, in the nervous system, where regeneration has long been thought impossible, stem cell-derived dopaminergic neurons are already being transplanted in early human trials for Parkinson's disease, aiming to restore motor function lost to neurodegeneration. These pioneering studies suggest a future where the progressive, irreversible loss of organ function with age could be halted or even reversed by targeted regenerative interventions. As these therapies advance, personalized regenerative medicine will become increasingly feasible. Induced pluripotent stem cells, iPSCs, created from a patient's own cells could be used to generate perfectly immunocompatible tissues, reducing or eliminating the risk of transplant rejection. Coupled with advances in gene editing, this approach could correct underlying genetic defects before tissue grafting, offering curative options for both age-related degeneration and inherited disorders. Moreover, bioengineers are exploring 3D bioprinting of whole organ scaffolds seeded with patient-derived cells, a technology that could one day produce fully functional replacement organs on demand. Yet major challenges remain, especially the aging microenvironment itself. Even the most youthful cells struggle to thrive in tissues with chronic inflammation, fibrosis, or degraded extracellular matrix, which are hallmarks of advanced age. Addressing this will require combining regenerative therapies with senolytics, anti-inflammatory agents, and possibly epigenetic reprogramming to create a more supportive soil in which new cells can engraft and function. Additionally, scaling up production of complex tissues, ensuring vascularization for oxygen and nutrient delivery, and standardizing manufacturing processes for clinical use will be crucial hurdles for widespread adoption. In practice, as regenerative medicine matures, we will likely see its first widespread impact in focal organ repair, localized patches or cell injections to restore heart, joint, eye, or brain function. Over time, however, the ambition will expand towards systemic rejuvenation, replacing or repairing multiple organs as they fail with age, shifting the paradigm of aging from a slow accumulation of irreversible damage to a maintainable, reparable condition. As clinical successes accumulate, regenerative medicine will increasingly complement or even supplant conventional transplants, with far fewer complications, longer-lasting results, and the potential to intervene earlier, before organ failure becomes life-threatening. The future of anti-aging medicine will almost certainly feature regenerative therapies as a central pillar, working alongside senolytics, metabolic modulators, and personalized gene interventions. Together, these tools could allow us to keep our bodies in a state of youthful resilience, dramatically extending both health span and lifespan. If we continue to make steady progress on immune compatibility, microenvironment optimization, and manufacturing scale-up, the coming decades could see regenerative organ repair move from a last resort to a routine, proactive component of healthcare, fundamentally redefining how we age and how long we stay healthy.